What we're going to be discussing during this segment is characterizing the severity of an infection with C. difficile. And there are two main factors to consider with regards to severity. One is whether the patient has healthcare versus community-associated infection, and the other is predicted through the blood work or the serologic assessment. Focusing first on healthcare versus community associated, we remind ourselves of a slide that was previously presented in the epidemiology section. This is a study by Lessa et al. That looked at a cohort of patients in the United States and compared those that had community associated infection, defined by the onset of symptoms within the community, or within 72 hours of admission to the hospital without being hospitalized within the prior 12 weeks, versus healthcare associated infection, everybody else. And what we can see in the bar graphs on the right-hand side of this slide is that those patients that had healthcare associated infection were at statistically significantly higher risk of 30-day mortality, 9.3% versus 1.3%. So those patients that have healthcare-associated infection have more severe infection, and as practitioners, it's important to think about treating them more aggressively. As a patient, it's important to realize that the healthcare-associated infections have more severe outcomes. The other factor to consider when approaching or considering a case of C. difficile and its severity is the blood value associated with that. And there are three important blood values that can be associated with worsened outcomes with this infection. Specifically, the white blood cell count, which is a measurement of system-wide inflammation, the creatinine, which is a measurement of the kidney function, as well as the albumin, which is a measurement of the protein levels within the blood. On this slide, we see a depiction of a graph and a table from the American Journal of Gastroenterology Guidelines published in 2013. And within these guidelines, it was recommended that patients that had severe infection be classified that way if they had an albumin less than 3, with either a white blood cell count greater than 15,000 or abdominal tenderness. So the gastroenterology literature favors using an albumin and a white cell count to predict severity. Within that publication, they also classified the so-called severe complicated or the worst severity patients according to a number of other factors, including changes in mental status or confusion, end organ damage, which happens when patients become bacteremic or bacteria gets into their blood. They also used a fever or a temperature greater than 38.5 Celsius, as well as ileus, where the bowel goes to sleep, or megacolon, where the large bowel dilates, as well as something called a lactate. A lactate is a blood value that increases when organs don't receive a sufficient supply of oxygen. And that happens when we are very, very sick. So with all of these factors, patients can be classified as having severe, complicated disease. The infectious disease literature chooses not to use the albumin, but uses the white blood cell count and the creatinine. And they recommend using a white blood cell count greater than 15,000 or a creatinine greater than 1.5 milligrams per deciliter. And this figure emanates from the Infectious Disease Society of America guidelines that were published in 2018. Within these so-called IDSA guidelines, they reclassified severe complicated infection into fulminant infection. And this was classified by hypotension or low blood pressure, ileus, the bowel going to sleep, megacolon, where the large bowel dilates, or shock. Shock is when the blood pressure within our body is insufficiently low. What I say is there shouldn't be a differentiation. Statistics have shown that the white blood cell count, the creatinine, and the albumin are all significantly associated with 30-day colectomy resection of the colon, and or mortality, death. Given this, the way that I typically recommend practitioners classify severity is using all three. As a patient, it's important for you to inquire about the levels of your white blood cell count, your creatinine, and or your albumin to find out the severity of your infection, and it will give you greater insight into your risks for poor outcome. In addition, you as the patient understand and know whether you have healthcare-associated infection versus community-associated infection. And by considering these factors, you will have the greatest insight into your risks for poor outcome and your need for more aggressive therapy.